Hello everyone. Today me and my team will be presenting a case scenario where it's about the blame game, that is a drug interaction overdose. So in order to better understand this scenario, let's first go through it. So imagine this is a pharmacy. You are in a pharmacy, it's 5:42 p.m. and there are so many people who are coming in. There's so many phones which are ringing in. There's a discussion that is going on between the pharmacist, pharmacy technician and the assistant, and there's so many people who are actually waiting for a pickup on in middle of this. Imagine a person coming in with a prescription. It's a very easy prescription, a clarithromycin prescription, right? So the pharmacy technician feels, oh, this is gonna take like what, 2 minutes, process the prescription, and as soon as you process prescription, now there is a big heading, that is there is an interaction between the clarithromycin and simvastatin, which the patient is regularly taking. Now the technician feels that, oh, I will just mention it about it to the pharmacist, and the pharmacist can take care about it. But the pharmacist, as was so much in pressure, forgets to look into it. Just give it like this. Just ask a patient, "Do you have any questions?" The patient is like, "No, I'm good with it." Pharmacist literally gives the medication, and the patient is taking the medication. After 2 days, out of nowhere, the pharmacy is getting a call that the patient who took this medication is in hospital right now because of rhabdomyolysis. That's a severe interaction. Patient is having lots of muscle pain, and now there is an argument that has started between the technician, assistant, and the pharmacist. Whom to blame, right? So let's introduce you to the assignment. So in this assignment, we'll be talking about what is a problem that happened, how accountability has failed here, what future recommendations could be taken in order to avoid this interaction, and we'll be also talking about what is a major role of the pharmacist in this kind of the scenarios. I will hand over to my friend.
So moving on to accountability questions in this particular scenario. What role should pharmacists play in ensuring decision support alerts are to make sure that they are used appropriately? So before we begin with that, pharmacist is accountable for two domains as discussed in Rosen's accountability in healthcare book. So which is the basis of our full course. Professional competence is something that has been compromised in this case. There is an alert that popped up showing that there is an interaction as Princey has already explained. So I need not go into further detail. So it is a CYP3A4 inhibitor. The levels of simvastatin goes up, the rhabdomyolysis happens, the patient gets hospitalized. So there is professional competence which is being compromised. Next is legal and ethical conduct. Even though there is a major drug interaction, the pharmacist neglects it, or the pharmacy assistant neglects it because of pressure or any other reasons, there is a legal and ethical conduct which is being compromised. So there is two areas which is already being compromised. Who is pharmacist accountable to? He's accountable to the patient, professional colleagues, pharmacy regulatory body, and this is the core of it. How to ensure decision support alerts are used appropriately. Pharmacists are taught to be stewards of medication safety. They're expected to identify drug-drug interactions. They're expected to identify dose errors if the drug is the right option for this particular disease. So they are expected to pick up all these things and find out if this alert is important or not. Second is designers and optimizers of clinical decision support system. CDS is clinical decision support system. So they are supposed to make sure that these alerts are identified by the pharmacist at each step, like be it from the processing of the prescription to medication check by the prescription by the pharmacist, or even at the dispensing time. Moving on to the next slide, you can see that what the next question was, what should have happened at the pharmacy counter? At the counter, the pharmacist could have paused the dispensing immediately, or even at the time of receiving the prescription, they could have identified this error. They could have contacted the prescriber by a fax saying that, is there an alternative for this? There's a particular major drug interaction. What are we supposed to do? Recommend holding the simvastatin or switching the antibiotics, counseling the patient regarding the symptoms, and documenting the intervention. Next slide. We can see that the workflow has failed in multiple steps. Intake failure, as already mentioned, the pharmacy assistant could have picked it up, but there it has been failed. And then there's drug utilization review failure. There you can see that the patient's profile was not assessed properly. A major drug interaction was they were okay to override it. Then there's counseling failure, no symptoms being explained, like these are the possible symptoms, this is the possible drug interaction. The patient was not counseled about anything. Documentation failure, they have not justified a reason to why they have made sure that they can neglect neglect this major drug interaction. This demonstrates that accountability is not just individual but should happen at a systemic level. Now, there is three accountability gaps, which is we have already discussed: professional competence gap, procedural accountability gap, and organizational governance gap. Now, coming to the blame game, which is in the next slide, you can see that here throughout what could have happened. The pharmacy assistant is going to blame that I thought that the pharmacist is going to pick up the drug interaction. The pharmacist is going to blame that the pharmacy assistant didn't inform me that there is a drug interaction at this level. So instead of blaming each other, the importance should be given to the patient safety, and this requires collaboration, cooperation, and shared responsibility. Moving on to the next slide by my friend.
So in this slide, we are discussing about the accountability and alert overrides in a pharmacy practice. So whenever the situation comes, like what all situation the pharmacist could override and what all situation a pharmacist should take a proper care of it. So first a scenario is like the prescriber already knows about the condition, like the medication, and they intentionally give the medication because it doesn't going to cause any harm to the patient. So in that scenario, the pharmacist just can record the patient details and the information and just confirm with the doctor regarding the drug interaction. That's it. And they can override the current situation. And next is like a minimal risk drug. When the prescriber give a minimal risk drug where like it is given for a short period of time, then also the pharmacist could override the interaction and can just record the information. Next slide, we are discussing about the drug interaction. That is like a risky drug interaction where the pharmacist could override, but only by taking proper steps. So, example, we can take our scenario, which is already discussed by my friend, like regarding the clarithromycin and the simvastatin. This clarithromycin causing a increase in blood level due of the simvastatin drug, which is causing a condition called rhabdomyolysis. So here the pharmacist could not override the interaction without discussing it with the prescriber or having a proper communication with the patient. And next example is like due to the work pressure without a clinical judgment, the pharmacist is just overriding it. Here also the pharmacist is failing in their accountability because they just override the interaction without have a proper analysis of the condition, and here they are causing a forum to the foreseeing the patient's safety. So next slide we are discussing about the steps a pharmacist should have taken like when they are dealing with a high risk drug interaction. One is like clinical assessment where the pharmacist should have a proper analysis of the patient's age, previous medication, and current condition he is having. Next is like he should have pharmacist should have a proper communication with the prescriber. So in this case scenario, the pharmacist should have talked to the prescriber about an alternative drug or should have discussed with a prescriber to stop the simvastatin for the time being. The patient is on the particular antibiotic. Next is like they should have communicate with the patient regarding the medication while dispensing the medication. Like they should have talked to the patient about the side effects of simvastatin and clarithromycin, like this muscle pain, uh, dark color urine. So in this case, if they find these symptoms, they should have taken immediate medical help and should have stopped the medication. So the role of pharmacist is not only the dispensing medication, they should have proper clinical judgment while they are dealing with this kind of scenarios. I'm just transferring my to the next slide, and my friend will discuss about it.
For this case, I propose implementing a safe structured protocol override, which includes rule one is a mandatory clinical pause. When a high severity alert appears, the pharmacist must stop the workflow and conduct an independent clinical assessment. Research by Nanji et al. 2014 states that the medication alerts are frequently overridden and sometimes without full evaluation. This states the importance of pausing to assess patient-specific risk factors, interaction severity, and safer alternatives. The second is prescriber verification is required. For serious drug-drug interactions, direct communications with the prescriber is very important in this case. Evidences from Address et al. 2020 shows that high priority drug interactions are always overridden at a very high rate, and inappropriate overrides are associated with adverse drug events. Regarding prescriber consultation reduces preventable harm and strengthens shared accountability. The third one is patient risk counseling is mandatory. The pharmacist must inform the patients about the interaction risk, the potential symptoms such as muscle pain or doc urine, and what care to seek. So, according to Address et al. 2020, improving responses to high severity alert requires strengthening clinical follow up and patient safety occasions. Next slide, please. Documentation is also critically important. For this, it involves prescriber communication and patient counseling. It must be recorded clearly. Emphasizing the structured documentation improves transparency and allows organizations to evaluate whether overrides are clinically appropriate. To ensure accountability, three method performances should be monitored. First, the high severity overriding rate supported by the findings from Address et al. Show that excessive override can relate to safety risk. The second is the prescriber contact documentation rate ensures that serious alert involve collaboration decision making, such as patterns identified by Nanji et al. The third is intervention and counseling documentation rate. The reinforcing safe follow-up procedures and following adverse events. Together, this protocol transforms alert override from a routine click to a deliberate, accountable clinical decision by combining structured rules, documentations, and measurable metrics. Now, my friend Princey will continue.
Thank you so much, all my friends, to for the greater insights which they have given in this scenario. I would like to give some future recommendations as we have discussed in the team. In order to decrease this kind of problems, the future recommendations we have decided is for the key recommendation is to move the blame game for the from individual person to the entire team. So each and every member of the team should be equally accountable in order to prevent this thing from happening in future. So the shared accountability, as mentioned by the Rose and Adele, plays a major role in this kind of scenario. The second, which we propose, is that to have a system in which there is an interaction alert in a way that it is impossible for the impossible for the pharmacist to override it. Thirdly, organization should have a perfect protocol which mentions that what steps has to be taken in this kind of scenario, and the pharmacist should also immediately contact the prescriber in this kind of situations in order and asking that what the alternative should be done in the situation. So these are the recommendations which we would like to take on. So in order to conclude the entire presentation, we would like to say that this case has given a proper presentation where there is a blame game which usually occurs in the healthcare system and which literally harms the patient's life. So, in order to prevent this, it's a high time for each and every member in a team to understand that every person is equally responsible and accountable. While it is easy to blame, individuals, it is more important to, because the patient safety is more important, it is more important to have a shared accountability. So in order to wrap up, the patient safety depends on the teamwork, communication, and the clinical judgmental. Where healthcare professionals move from blame to share accountability, we create a safer and more reliable healthcare system. Thank you so much.